Hi, I'm Dr. Avantika Tripathi, oral and maxillofacial surgeon, course mentor Dentium. Today, I will talk about the prosthetic components of Bright Implants. Whether you are a seasoned clinician or refining your practice in implant prosthodontics, understanding the function of each component is essential for predictable outcome and long-term success. Let's explore all the key prosthetic components of Bright Implant one by one. We will start with the foundation, the Bright Implant fixture. The fixture is the endosseous component placed into the jawbone designed to achieve osseointegration through direct bone-to-implant contact. Bright implant fixture are of two types, bone level and tissue level. Bone level is completely inserted inside the bone. Tissue level has an abutment sort of structure over the bone level component of fixture. Bone level implants are typically favored in aesthetic zones or when the bone structure is critical to support a crown. Tissue level implants are mainly used in those areas where the soft tissue support is critical, such as in the upper arch, or where the implant is more required to be visible in the soft tissue area. Coming to the design variations of bone level, it has a tapered design. It has a 3.7 mm deep connection and 10-degree internal taper. So the large abutment contact surface area prevents loosening when using non-hex abutments and minimizes the sinking down of the abutment. Long cutting edge and aggressive thread design helps increase the initial stability, and easy and fast insertion of implants can be done. Now let's discuss the design variations of tissue level implants. It has a dome-shaped body which will protect the marginal bone from resorption. It has a standard platform diameter of 3.8 mm for all diameter implants, which will provide a simplified prosthetic workflow. It has a 20-degree external taper fit, which will provide external conical seal effect, high flexibility and strength. It has a thin and deep thread design, which improves the torque efficiency, primary stability, and allows immediate or early loading. Coming to the surface treatment of Dentium Bright Implants. Basically, the surface treatment is a technology to improve the corrosion resistance or mechanical strength of any raw material by changing only the external surface, not the entire surface, or providing them some special function that the raw material do not have. In Dentium Bright Implant, the surface treatment is SLA, that is sandblasting with large grits and acid etching. Let's move on to the healing abutment in Bright Bone Level Implant. Before placing the final prosthesis, a healing abutment is placed to facilitate soft tissue maturation and contouring around the implant site. Healing abutment helps in promoting ideal gingival architecture. It is available in different diameters and different gingival height. Either we can place the healing abutment immediately after placement of implant, or we can place it after 1 to 2 weeks post osseointegration phase. So, right now I am going to place the healing abutment over my bone level Bright implant. So, I have just screwed it with the help of this hex driver. So, we can choose the gingival height and diameter of the healing abutment according to our case. So, over the bone level implant, we have to put the healing abutment for the formation of gingival collar around the implant. And over the tissue level implant, we have to put a comfort cap. There is no need to put a healing abutment over it because already there is a abutment sort of a structure present over the tissue level implant. Let's start with the impression copings of Bright Implant. So, the impression copings are of two types, bone level and tissue level. The bone level impression copings are again of two types, the transfer and pickup, that is closed tray and open tray impression coping. The tissue level impression copings are again of two types, closed tray and open tray impression coping. Let's tighten these impression copings one by one in the dummy implant placed in this dummy model with the help of this hex driver. Let's place the closed tray impression coping of both bone level and tissue level implants. This is the tissue level impression coping of closed tray impression technique. So, I am going to tighten the impression coping now. If you can see, the size of the closed tray impression coping of tissue level is very small, as there is an external hexagonal connection over the tissue level implant, so it is going to fix it on the top only, whereas in bone level there is an internal hexagonal connection, so the impression coping is going to go completely inside the fixture. Now let's tighten the impression copings of open tray technique in the bone level and tissue level bright implant. So this is the open tray impression coping of bone level fixture, and this one is the impression coping of tissue level fixture. The size of this impression coping is small and it is going to fix on the external hex of the fixture. All the impression copings in bone level and tissue level are available in different diameters and different gingival height, which we can choose according to the cervical diameter and gingival height of our patient according to the case. If you want to learn the procedure of open tray and closed tray impression techniques, then you can look for our previous videos. Now let's discuss the final abutment used for the fabrication of the prosthesis. Once the osseointegration is achieved, the abutment plays a major role in connecting the implant with the prosthesis. Abutment selection significantly impacts the peri-implant tissue health, emergence profile, and long-term aesthetics. Abutments are mainly of two types: stock abutments and custom abutments. Stock abutments are of two types: digital abutment and TI base. They are prefabricated and are available in different diameters and gingival height. This is the digital abutment, bone level and tissue level. It comes up with the delivery holder, so we just have to pick up the delivery holder and place the digital abutment inside the fixture, and we just have to tighten the screw over it through the delivery holder. Place the screw over the digital abutment through the delivery holder. We will tighten it completely, and after complete tightening we will remove the hex driver and we will gently twist the delivery holder to remove it. Now let's place the tissue level digital abutment. So again we just have to pick the tissue level digital abutment with the help of the delivery holder. We will place it over our fixture and we are going to place the screw over it through the delivery holder. So I'll just pick up the screw with the help of hex driver, place it through the delivery holder, and I'm going to tighten my abutment completely. After complete tightening, I am going to remove the hex driver and I will gently twist the delivery holder, remove it completely from the digital abutment. If we are going with the digital process of making the prosthesis, then we just have to place the digital abutment after choosing the correct diameter and gingival height according to the case, and then we can simply scan these digital abutment and send the data to the lab for making the prosthesis along with the same digital abutment. Coming to the customized abutment, so in the customized abutment we have the option of TI blank, which can be designed and milled according to the gingival architecture of the patient, and it will ensure the optimal fit in the patient's implant. It comes up with the screw and it can be easily fitted according to the gingival architecture of the patient. If we have placed an implant at a certain angle and we want to make it straight in the oral cavity, then we can use this TI blank to change the angles of our fixture. So the angle correction can be done up to 30 degree with the help of these TI blank, bone level as well as tissue level. These are the bright implant analogs, tissue level and bone level. Analogs are the replica of fixture which is placed inside the model, which is used for the fabrication of prosthesis. These analogs will serve the purpose of both digital as well as manual method analogs. If we are going with the digital method, then also the same analogs will be used. If we are going with the manual method, then also we are going to use the same analogs. That's all about the prosthetic components of Bright Implants. With a thorough understanding of each prosthetic component, you can definitely plan and execute most complex cases. If you like the content of this video, please like, share and subscribe to the channel. Thank you.